Gonorrhea.
The causative agent of gonorrhea is Neisseria gonorrhoeae. Neisseria gonorrhoeae was discovered by Albert Neisser in 1879 and soon proven to be the causative agent of gonorrhea. Neisser demonstrated its presence consistently in patients with symptoms, and when discharge in cultures of Neisseria gonorrhoeae was introduced into the urethra of healthy men, it caused the disease. Prior to this discovery, the disease was known as the clap, and the cause was unknown. Neisseria gonorrhoeae is a gram-negative diplococci bacteria, meaning they are seen in pairs. Gonorrhea is sexually transmitted. It can be transmitted through sexual contact with the genitals, rectum, or mouth of an infected partner. It can be transmitted through infected bodily fluids. This allows for it to be vertically transmitted from a mother to child during childbirth. When transmitted through childbirth, the infection often occurs in the eyes, which can lead to blindness.
Symptoms may appear 2 to 21 days after contact with an infected person. Some men with gonorrhea may have no symptoms at all. However, men who do have symptoms may have a burning sensation when urinating, a white, yellow, or green discharge from the penis, painful or swollen testicles. Symptoms in women can include painful or burning sensation when urinating, increased vaginal discharge, vaginal bleeding between periods. Rectal infections may either cause no symptoms or cause symptoms in both men and women that may include discharge, anal itching, soreness, bleeding, painful bowel movements. Oral infection symptoms include sore throat and other signs of gonococcal infection, discomfort when swallowing. Gonorrhea and infants. An infected mother can pass the infection to the baby as the baby passes through the birth canal. If left untreated, this can develop into eye infections. Diagnosis. Most of the time, urine can be used to test for gonorrhea. However, if you have had oral sex and/or anal sex, swabs may be used to collect samples from your throat and/or rectum. In some cases, a swab may be used to collect a sample from a man's urethra or a woman's cervix. Diagnostic tests consist of LCR urine or swab, 50 to 95% sensitive, 100% specific. A culture, 65 to 85% sensitive in asymptomatic patients, 100% specific. A gram stain, only 60% sensitive in symptomatic women, 100% sensitive in symptomatic men. High prevalence of co-infection with other STDs, such as chlamydia. It is important to do a complete STD screening.
There is a treatment for gonorrhea. Gonorrhea can be cured with modern medications. People with gonorrhea are currently treated with a drug called ceftriaxone. Ceftriaxone belongs to a class of drugs called cephalosporins, which work by preventing the bacteria's ability to produce and maintain their cell wall. And without a cell wall, bacteria cannot survive. Ceftriaxone is administered as a single 250 milligram intramuscular dose. People with gonorrhea are also found, in mostly all cases, to be simultaneously infected with chlamydia, which is another sexually transmitted disease. Therefore, most gonorrheal infections are treated with what they call a dual therapy. The drugs used in combination with ceftriaxone is either azithromycin or doxycycline, which are both antibiotics that work by inhibiting protein production. These drugs might be taken in a single dose or orally 2 times a day for 7 days. Once all medications are finished, patients are advised to wait 7 days before resuming sexual activity. Now, as far as drawbacks to treatment go, there are problems. The emergence of resistant strains. Treatments have changed since the 1940s at least 3 times due to the emergence of these resistant strains. And as mentioned earlier, ceftriaxone, which belongs to the drug class called cephalosporins, are used. The Center for Disease Control is monitoring this closely because treatment failures due to resistance have already been reported as early as the year 2000. The only way to truly avoid this sexually transmitted infection is to not have vaginal, anal, or oral sex. This is referred to as abstinence. But if you're like the great majority of the human race, abstinence is not an option for you. So there are 2 things that are recommended for you to do that can lower your chances of becoming infected with gonorrhea. The first recommended thing is the proper use of latex condoms every time you have sex. The second recommended action is that before you enter or begin a long-term mutually monogamous or exclusive relationship is that you both be tested for STDs and receive negative results.